What you're not told about masturbation in men over 50. Could this habit be beneficial or harmful to your sexual health? Let's find out. During the COVID-19 pandemic, social isolation measures, combined with changes in daily routine, significantly altered the sexual habits of the population. This was true for both young and older adults. This was particularly significant among patients who isolated themselves more from society, meaning the 50-plus demographic. In this regard, some habits were incorporated into these individuals' routines, such as increased pornography consumption associated with the practice of masturbation. Currently, we have very limited literature regarding the effects of masturbation and pornography consumption in this older population. It is known that patients over 50-60 years old are those who are physiologically undergoing certain changes in their bodies, such as a decline in testosterone production, and also some alterations in their cardiovascular health. Consequently, these patients have risk factors for potential conditions like hypogonadism, andropause, and also erectile dysfunction. The fact is that the practice of masturbation, whether associated with pornography consumption or not, can worsen conditions of erectile dysfunction, ejaculation disorders, such as premature ejaculation or delayed ejaculation, the condition of anorgasmia where the patient cannot achieve orgasm, in addition to potentially drastically altering their libido, their sexual desire. Masturbation conditions a man's brain to achieve pleasure, orgasm through self-stimulation. However, these stimuli are not replicable when a man is in a real sexual relationship with his partner, as the pressure, intensity, and frequency with which he stimulates himself are completely different from those developed during a sexual act. The same logic can be applied to pornography consumption. We know that the pornography industry is artificial, something unreal. These sensory visual stimuli cannot be reproduced in a real sexual relationship when a man is with his partner. Consequently, states of decreased libido, hypoactive sexual desire, in addition to erectile dysfunction and ejaculation disorders, can be facilitated in men who consume a lot of content from the pornography industry. It is logical that these negative impacts depend on the social context in which the man is situated, his general health status, and the frequency and manner in which he engages in the practice. For example, when the habit of masturbation or pornography becomes a compulsion, an uncontrolled urge which starts to interfere with interpersonal relationships, personal or work routines, this can indeed be considered a disease, and this patient needs to seek medical help. This can be a risk factor for emotional disorders, conditions of anxiety, chronic stress, and even depression. Regarding masturbation, it is necessary to debunk some myths, such as that frequent masturbation and ejaculation are capable of reducing the risk of prostate cancer. Folks, much is said about this association of an increased number of ejaculations being a protective factor against prostate cancer. But the truth is that there is no strong scientific evidence or large clinical trials, scientific studies that directly prove this association. Therefore, the practice of masturbation is not proven to be a protective factor for the onset of prostate cancer. Furthermore, it is a myth that masturbation can increase libido in a couple or in a man. Quite the contrary, excessive masturbation can create a natural desensitization, meaning many men end up losing interest in real physical relationships with their partners. If this is interfering with your sexual life, your marriage, seek medical help as this can have a solution. Another important point is to discuss penile disuse. Many patients are concerned due to a hypoactive sexual life and opt for masturbation associated with pornography consumption. As a form of substitution and an even more appropriate treatment, we can advise these patients to use pelvic physiotherapy, vacuum therapy, pelvic floor exercises, which are Kegel exercises, which strengthen the muscles, improve vascularization, blood flow, therefore, better condition their pelvic health. Masturbation cannot be considered a solution for penile disuse or atrophy, since, especially in this risk population, in adults 50+, it can be associated with the development of hypoactive sexual desire, decreased libido, the onset or worsening of erectile dysfunction conditions, and ejaculation disorders, such as difficulty controlling ejaculation, premature ejaculation, or even anorgasmia, where patients cannot reach orgasm. If you're over 50, you've probably noticed that certain things just don't work like they used to, and if masturbation has become a frequent habit, it might be mentally conditioning you to fail precisely when it matters most. The good news is there's a natural, safe, and fast way to restore the potency you had at 20, without needing medications or expensive treatments. A simple 7-second daily ritual, based on a scientific discovery, is helping thousands of men recover firm erections, intense desire, and the confidence to perform in bed, even after 50. If this resonates with you, scan the QR code here on the screen or click the first link in the comments to watch the full video now. Don't wait. Your partner and your virility will thank you.